The 10th season of Consider This is brought to you in part by Blooms in Omaha, featuring floral arrangements and gifts. And by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.
Consider This, a program of issues and information behind today's news. Once again, from the campus of the University of Nebraska at Omaha, here is your host, Andrea McMaster.
Hello everyone, I'm Andrea McMaster and thank you for joining us for this edition of Consider This. Well, this is a week that's not often highlighted, but we think you need to know about it. National Medical Laboratory Professionals Week is this week, and it's a week set aside to recognize the thousands of workers who conduct the laboratory tests that allow doctors to make the correct diagnosis on patients. In fact, 70% of medical decisions are based on lab results. They are called clinical laboratory scientists, and we have three guests with us today from the University of Nebraska Medical Center to talk about their profession. And Janet Schmidt is the first person we want to introduce today, and Janet Schmidt is the assistant instructor and recruiter for UNMC's Clinical Laboratory Science program. I'm glad that you could be here today, Janet.
Yes, thank you so much for inviting us.
And we also have with us Linda Fell, who is the Clinical Laboratory Science program director at UNMC. And we have one of the students, had to have a student representative with us, Melissa Falk, who is the Clinical Laboratory Science student, also at UNMC, but set to graduate. Just a couple weeks to go.
Yes.
So that's exciting. Well, Jana, I just want you to give us a little bit of background first here on what is a clinical laboratory scientist. When people hear that term, what should they think of?
Well, everyone has laboratory testing done, but people don't often think about who are all these people that actually perform the tests, look them over, and make sure they fit a pattern before we report them back to a physician. And so we're the ones that are doing all the blood work on blood, body fluids, different specimens that we might need to have laboratory testing done on. So we perform all those medical tests. It's not x-ray or any of those types of testing, but all the things on blood and body fluids.
70% of medical decisions based on these lab results. So it's
so we're a very vital part of the healthcare team. And that's why we're here, because there is a severe shortage of us right now. And we perform a wide array of testing. We perform chemistry testing, so that's like your cholesterol testing that everybody hears about, and your glucose testing, but then it also includes therapeutic drug monitoring. So we also do toxicology, so maybe you'd see something on an autopsy patient, you know, how did they OD, but then we also use that same technology on a patient that has an infection and they need their drugs to be at a certain level to work, and so we do all that kind of testing. We also do hematology testing, and that's looking at the different blood cells. So we help diagnose leukemias and anemias and bacterial infections and infectious mono and things like that. But then we also do microbiology testing, so we actually grow up some of these organisms and viruses and then do drug testing against them. And so we give all that information to the physician. And we also do a lot of molecular and DNA testing, and that's what usually gets put in the news a lot, is all the different new genetic testing that's coming out to type cancers, to find different infectious disease agents without having to be harmful to the people working on them. And then we also do forensics work, which is something that not a lot of people know about. And so we're the ones that map out the DNA and go to court and testify. But then we use that same technology with the DNA mapping to match donors for transplants. So it's a huge wide variety of things that we're all trained to do.
And it is a behind-the-scenes profession, so maybe one of the reasons why there is a shortage right now is a lot of people don't know about it unless it is in the news. We see it on television shows like CSI, however, and you said that you do some work like a person on CSI might do.
Yeah.
How similar is it?
It's actually pretty similar in some facts. The Jessica O'Grady case that just happened, the chief DNA analysis on that trial was Melissa Helisco, and she's actually a clinical laboratory scientist that works in forensics for UNMC. And so she actually does a lot of that part when testified on the trial and things like that. Some of the stuff that you see in CSI is what we would do, like the different drug testing, testing the blood for different agents, maybe chemical agents, things like that. We aren't the ones that go to a crime scene and collect evidence and things like that. You never would interview suspects. But we do get stuff in all the time from police bring it into the laboratory to have the DNA work on, and then also if the patient is deceased, then we get all the autopsy specimens and we do all the testing and analyzing of those.
How realistic is it when you're watching that show? Do you sometimes giggle at yourself saying this is just really far out?
Testing usually doesn't happen as fast as it does on that show. They usually put something on an instrument and all of a sudden it just prints off an answer automatically, and it's usually some tests are an all-day process with multiple steps going into it. And so they kind of just cut out that little part, but we kind of giggle because some of the stuff that we do all the time, like pipetting and just looking at slides, they make it seem very dramatic. But I would also like to add, you're not in a dark room by yourself all the time, and nobody comes to talk to you unless they need that result right away. You're actually surrounded by other clinical laboratory scientists and other healthcare professionals, and if you work in forensics, you're constantly in contact with law enforcement and things like that. So the perception of you having to be by yourself and kind of working in a dark closet's kind of a bad stereotype, but at least it gets the picture out there that lab people do exist and we are a vital role in healthcare.
So where can clinical laboratory scientists be found? Obviously the University of Nebraska Medical Center, but are there other healthcare fields, clinics that do have professionals as well?
A clinical lab scientist, one thing that's great about this profession is you can work in a variety of different areas. You find us in the hospitals, but a lot of times larger physician offices will have us in there doing some of the basic and routine testing so they can get it back to the patient right away without having to send it off. We're also found in reference laboratories, which are big laboratories that aren't necessarily connected right to a hospital, but they perform testing on specimens and they do the more unusual testing that maybe doesn't have routinely done. And so if you have like a really weird type of cancer that's very rare, we might have to send that off to a specialized place to have testing done on it. We also are in forensics labs, as I mentioned earlier. Some of us actually go back into research because we need people to come up with the instrumentation that we use and some of the different tests that we perform. And then there can also be found in pharmaceutical companies because with human trials and things like that, we need to do lab work on our patients to make sure the drugs are where they need to be and nothing is harming the patients. And then we're also in sales and industry because we need people to actually know how to work the machines to go out and sell them to the hospitals. And then if we have problems with our instrument, we can call them up and they know exactly what we're talking about. So you can work in a variety of different areas, especially it's a very flexible place to work because you can work in all those different areas I talked about earlier and all these different work environments. So your possibilities are pretty much unlimited with this one degree.
Well, I want to reintroduce then Linda at this point and just kind of say, after all this, hearing all this background, why do you think that the shortage exists then at this point?
There are a couple of reasons. Part of it is the fact that we are indeed in the background, but that is changing definitely. The role of the clinical laboratory scientist is changing. The stereotype was always they were kind of in the basement behind a microscope, but now we are out there very much involved in health care team approach, patient education, etc. Some of the reasons, though, that it's a demanding field and the people that go into it are very bright, and there's a lot of competition for bright young people these days in different professions. And also the aging of the profession, I can talk to that, that a lot of the clinical laboratory scientists are going to be within retirement age in the next 10 years. And just the plain old growth of laboratory testing and the technology. So those factors combined have resulted in quite a severe shortage.
Okay, you can receive two different types of degrees, yes, right? An associate and a bachelor's degree. So explain what the difference is.
Yes, the associate degree is offered through a community college, and those folks graduate with an associate degree in clinical laboratory technology or technician, also known as medical laboratory technicians. And so sometimes you'll see the phrase MLT or CLT. Those persons are prepared to do basic laboratory testing. A lot of times they'll work in a hospital or a small clinic. We have 3 associate degree programs in Nebraska, one of which is in Lincoln, one in Hastings, and one in North Platte. The baccalaureate level of education is what we provide through the University of Nebraska Medical Center, and we prepare our graduates to be more in the management, supervision, more involved in the actual interpretation and correlation of laboratory results. We certainly educate our students to be able to perform testing too, but the more sophisticated testing also, the DNA, the forensic testing, would be done by a baccalaureate prepared clinical laboratory scientist. We're also, both levels are certified nationally. You can't just get a degree in biology and go work in a laboratory. You have to be nationally certified. And so our program that results in the baccalaureate degreed person, we prepare those students to take a national certification examination, and then they are qualified to work in a clinical laboratory.
Is there somewhat like a residency for a physician? Is there training in?
Our actual year, the baccalaureate program to which I can speak, the students have 3 years of college before they come to our program. During our program, it's like the senior year of college, but it's very integrated. It's not like Monday, Wednesday, and Friday you take classes. They do earn 39 semester hours during that year, and it is a full 12-month year, but it is mixed didactic and practical experience. And so, for example, Melissa's just finishing her 9 months of being in a clinical laboratory, doing a lot of didactic testing and paper writing and interpretation and correlation, but she also was performing laboratory testing during that time. So in the past, in fact, they used to refer to that senior year as an internship, but it's such an integrated educational experience that we don't really use that term anymore.
But a lot of hands-on experience
exactly.
before the graduation.
Yes, when they graduate, they are fully functional.
Are there any advanced degrees in clinical laboratory science?
Yes, indeed. Many people that graduate with a baccalaureate degree, then they can go on, and as Janet mentioned, there's many different areas that you can focus on. So you can focus on the scientific side. You can get a master's degree in microbiology or a master's degree in education, or go on into research and get a PhD. We also, there are a few programs in the country that actually offer a master's in clinical laboratory science, and in fact mine is in pathology, which is very similar to that. Now that we have so much online education that anybody can get a master's degree. The newest thing on the horizon is actually a clinical doctorate. And some of the other professions, like the PharmD or the DPT, the doctorate in physical therapy, have gone to this model, and we are too. Our entry level will remain the baccalaureate degree, but for the clinical laboratory scientist who wants to go on and be more involved in patient interpretation, education, etc., they will be a clinical doctorate in clinical laboratory science.
And why would someone choose to get a higher degree in?
Career satisfaction, I would think,
Okay.
the desire to do more, to be involved more. It's a very challenging, exciting field, and so we're always promoting lifelong learning, and particularly laboratory scientists are very much into that because the technology changes so much. There's some new things to learn all the time. And so that is one reason that if they would just like to become specialists in their field and get additional education.
Have you seen the technology change a lot in your years in the profession?
Indeed, I have. I've been in the clinical laboratory profession for over 30 years, and the changes, I keep telling the students I'm jealous. I wish I could be starting over because it's a wonderful time to be in the profession. So many exciting things because of technology, because of the sensitivity and specificity of laboratory tests. But for example, when I started as in those days we were called medical technologists, I was a young med tech, it was great fun, but it was very basic, more hands-on. Now a lot of our instrumentation is automated, so we may not be doing the same kind of work. Now we're doing more of the, like I say, interpretation, correlation, making sure that the data we produce, and I also tell the students on the first day, our product is really information. We do laboratory testing, but our product is the information that will allow the clinician to interpret and treat the patient.
And that's also why there's a huge need for new people to come in, the younger generations to start diving into this profession, is because the testing is changing so fast and it's going really advanced on the molecular level that a lot of our staff and the clinical laboratory scientists didn't even have genetics courses when they went through their schooling, and so we were really relying on these younger generations to just start the path running and just dive right into all this new technology because it's so advanced, and because it is kind of a different type of a language and just a different thought process, we need people to educate the other professionals about it. So that doctorate of clinical lab science, we want that person to be on the floors with the physicians, because the testing, when it comes back, it's not positive or negative. It's this whole, lingo of jargon that the physicians have a hard time interpreting. And so if we could have that lab person on the floor, along with the clinical pharmacist and the other healthcare professionals, we think that it would cut down on maybe misinterpretation, and they would know what test to order right away, because they just change so fast that it's hard for us to keep up on, let alone other healthcare professionals.
And that's not necessarily reality right now, but it's moving that direction.
The reality is the situation, but yes, more and more the laboratory scientists are becoming members of the team when they go onto the floors, especially in the areas of infectious disease, because again, there's so many antibiotics and so much to know that the laboratory scientist often does do rounds with the physicians, but the actual formalization of the clinical doctorate is in the works right now. We have students going through programs, but we have not had any graduates.
Okay. Well, Melissa, why did you choose to go into this field?
I chose this field ever since I was little. I loved science and loved studying science, and I thought I wanted to be a veterinarian, so I got experience working at a veterinary hospital. As I got older, they let me do some lab things and see things on the microscope, and I realized that I really liked helping decide the lab work and decide the course of treatment that was going to be taken. So I asked a lot of questions and talked to the right people and found this program and got in it. So. And
tell me what you've been doing so far, because you've been working really hands-on recently.
It's a very intense year. I think coming into it, I was a little naive. I thought, it's not going to be too bad. One class at a time, it'll be okay. There's a lot of tests. There's a lot of lab work. You're in the lab all day, and then you go home and you study for a test you have every week. But at the end of the day, it's rewarding to know that what you're doing is helping somebody or saving somebody's life. So,
are there certain areas that have just really sparked your interest so far?
I really like micro, just because I like dealing with the organisms. It's not the routineness of the rest of the lab. It's different every day. Somebody could be growing something completely different from somebody else. So just isolating the organisms and finding out what it is and if it's harmful or not. I really enjoy that. But I like all aspects of the lab, and I have a good time working in chemistry and hematology and correlating everything together. So.
And what was your class load like in basing it, I guess, on another medical profession? Did you take a lot of similar classes that maybe someone going into the nursing profession might take?
Before I came to this program?
Yes.
Yeah, I took, I thought I was going to go to veterinary school, so I had based my college towards veterinary medicine. But in doing that, I left myself open for any medical profession that I wanted to, because the classes are very similar and a lot of the background is similar. So by doing that, I was still able to get in without having to take any other classes or readjust my schedule. So.
Okay.
A lot of the same courses needed for pre-health programs are the same. They're pretty similar to the clinical laboratory science program. We're a little heavy on the chemistry side, just because we need that more higher level of thinking and things like that. And so usually if you're on a pre-med track, you usually hit up most of our prerequisites to get into our program.
And I know we have 3 women here representing the field. Is that commonplace in the field today?
It is definitely changing. I think it used to be kind of a woman's profession, although there were 2 gentlemen in my class many years ago. But no, there are very many gentlemen. Some of them would come into the profession because they want to do the industry. They're kind of more mechanical minded, if you want to. And also a big part of our profession, as I was kind of promoting earlier, is the fact that we generate so much information. So a lot of computer people that are liking computers, and a lot of those that seem to be gentlemen at this point, they will become clinical laboratory scientists and then focus in the laboratory information side of
More
things.
the technical aspect.
But this year we have about 25% of our class. And in some years it's higher than that.
Okay.
So.
Okay. Well, how is the laboratory environment different than like a medical research laboratory?
I actually worked in medical research before I became a clinical laboratory scientist. And how it's different is research, you're developing testing that might be used in the future. So you're at the very basic stages. You're usually on animal trials, doing things like that, coming up with procedures on your own by pulling together procedures from other people's work. And then you might, if you're lucky, you can do like a few human trials and things like that. And so it's very removed from direct patient care, which medical research has a very important place in the healthcare system. But for me, I wanted something that had a more direct impact on patient care. But I really enjoyed doing the actual laboratory work, using the microscope, just growing up different organisms, using all my scientific knowledge that I could. But then I wanted to apply it directly to the patients. And so then I found this clinical laboratory science program. And so I actually get to do a lot of the same techniques and research, but I get to do it directly to patients. And so I feel like every single day I'm affecting hundreds of patients, where my research, I was kind of working on the same experiments over and over for a while, and then I would publish a paper, and then I'd start another experiment. And so it's a very important part of medicine to have those stages and to come up with the new techniques. But clinical lab science, you take all of the research and everything that research has come up with, and then you apply it directly to the patient. And so it's pretty much all the kinks have been worked out of most of it. So that's kind of nice, because it usually almost works all the time, where research is a lot of trial and error. So I like my stuff to work all the time. So that's one reason I like it a lot better too. And then I liked working in a hospital setting and not off of government funds and things like that. So the pay was a little more stable. So that's just another thing I enjoyed too.
Okay. Well, talk a little bit about what a day in the life of a clinical laboratory scientist might be, and maybe in a hospital setting, because I'm sure it's different in lots of different settings. But can you kind of give me a general idea?
It's kind of hard to answer because there's so many different areas that you can work in. But say you're working in chemistry or hematology, sometimes those two departments are combined. And so you might for a while be doing some rapid testing on patients, things that might only take 10 minutes. So you put it on your machine, double check the results, and get the results to the physician right away. But sometimes if there's anything abnormal with those results, it requires some further testing. So you might be working in the rapid area for a certain amount of time during your day, and then we switch out. And so then you might perform some of the longer testing that takes a couple hours, or you might have to look through the microscope for a while and things like that. If you're in a blood bank, you'd be checking all the stuff that comes in from the Red Cross. We also work in the Red Cross also, and making sure the donor bags that come in, everything is labeled correctly and what the blood type is on the bags is correct. And then you get stuff in from the patients, and then we actually type out the patient's blood, and then we take that donor blood and kind of mix it together and see what reactions happen. And if there is a reaction, then you have to find out why. So it's very critical thinking, and there's a lot of genetics involved and things like that. So there's a lot that takes place before someone can get a transfusion. If you're working in a microbiology lab, usually like all through the night, we have people setting up different specimens to agar plates that actually grow up the bacteria. And then the next day you come and you look at those plates and you sort out from what's growing, what's a pathogen and what's not, because you've had all that training. Because there's a lot of things, like your throat has a lot of bacteria in it, but not all of it's making you sick. Some of it's actually preventing you from getting sick. So we can pick out which things are a pathogen per body site. So we'll identify those, and then we'll set up the antibiotic testing against those.
So when you hear a physician saying, well, I'm just waiting on some lab test results, this is really true in order for them to make their diagnosis. Yeah.
We're the ones running around like crazy trying to get it out as fast as we can, but we also want to make sure it's accurate. And so that's really why we're worried about the shortage, is because if we don't have enough people in the laboratories, it's going to take longer for patients or for physicians to get their lab results back. And then who knows, if we have to start bringing in people that aren't qualified, the quality of your lab results are going to go down. And so that's something that all of us are really worried about, because you want to know that if they're typing your cancer or doing the test that says you have cancer or not, we want to make sure that that's the right result and you aren't misdiagnosed. And so that's why we really need more people to come into the laboratory sciences.
So getting the word out is definitely key, and new graduates like Melissa is definitely going to help. And Melissa, you already have a job, right?
Yeah, I do, as well as several of my classmates. So it was it wasn't difficult, but it was nice to be able to not have to worry about having a position right after I finished. So I know with a lot of professions, people worry about, oh, am I going to get a job or not? So.
And you already started.
Yeah, and I've already started, so it's been real nice.
Story.
Yeah, that's great. And where are you working? Can you share?
I'm working at Westroads Medical Center, which is a larger physician's clinic. So we do a lot of chemistry and hematology and urinalysis work. So.
Okay.
And that's one thing that is nice with this degree, the Bachelor's in Clinical Lab Science 4-year degree. It's a very marketable degree. People are out there begging you to come and work for them. If you just get a bachelor's in biology, biotechnology, or chemistry, you're really limited to only research, where we have all these other areas. And there are a ton of graduates from colleges all over the state that are graduating with those degrees. So in those situations, it's more pick me, where with this degree, people are begging you to come and work for them. So that's always,
which is a good note to be in.
Nice.
We've gotten several emails saying we need a position in California, or I could go all over the country to do what I've been studying, so it's been very nice.
And come and work here.
Yeah.
I might just add quickly that our program actually does serve the whole state of Nebraska. We have clinical sites in Kearney, Grand Island, Hastings, North Platte, and Norfolk here in Nebraska, in Casper, Wyoming, Sioux Falls, South Dakota. The University of Missouri at Columbia has contracted with our program, and the University of Iowa.
Wow.
So there's ample opportunity for people to get this education close to their home, and that certainly will help the shortage.
Yeah, that's phenomenal. Well, I want to make sure that folks have the website as well. That's www.unmc.edu/alliedhealth/medtech. More information, a couple of phone numbers for you too on the Clinical Lab Science program at the University of Nebraska Medical Center, 402-559-7810, or toll free is 1-800-626-8431, and that extension is 7810. We're so glad that you could be with us today, and thank you for joining us for this edition of Consider This.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours.
The 10th season of Consider This is brought to you in part by Blooms in Omaha, featuring floral arrangements and gifts. And by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.